My name is Denis Horgan. I'm the Executive Director of the European Alliance for Personalised Medicine. Very exciting milestones. We've developed two draft policy papers, one focused on prevention strategies and one focused on the use of data. Now we have a new European Commission and a new European Parliament. So these are two crucial papers. If it's approved by the consortium, we can give guidance to the policymakers what's the best way to facilitate the objectives in iBECHANGE. One challenge is we have a new Parliament, a new Commission. So while priorities were very much focused on cancer before, there may be less of a focus in the next legislative period. Also, healthcare was very much to the fore because of COVID-19. Now we have competing interests such as Ukraine or climate change, which are all equally important, but it may take the focus away from healthcare. So we have to ensure that there is a key focus on healthcare to move the political dimension forward. Because we really need political support in terms of funding, but also the regulatory frameworks that can support it to ensure that different actors at a national level, a regional level, or European level can work together. But then you need the resources to support them in the good work that they're doing. So this is a challenge. The work package is very much a bridging work package because we're focused on communication, dissemination and policy. A lot of the other work packages are more technically focused. So our work package has to internally communicate between the different work packages, but then externally communicate to different audiences. And this can be with the different public health professionals, patients or citizens, or different medical specialties, but also policymakers. So we have to act as a platform, really, to bring the different expertise from the different work packages, understand their key concerns or key challenges, to frame it in the policy area, and then communicate to the policy makers. So in this sense, we have a very good collaborative framework. So we've developed two policy papers, as I mentioned, one on preventative strategies to give guidance to the policymakers, and a second paper on data, and it will be a forthcoming paper on health literacy. No easy task to reach consensus at a European level when you have different experts coming from different countries and to understand their particular issues at a system level, and then see what are common strands across these healthcare systems, what could be a focus at the European level. But we managed to do this in these two policy papers. So this is a milestone in itself. Now we have to translate this into the policy world and see if the European politicians and institutions can support this in a more of a practical way. But reaching consensus, because Europe consists of 27 member states with 27 different healthcare systems, and even more complicated when they have regional healthcare systems. So we have these two papers now which provide like a status quo of what we want to do in the area and then how we can move forward. And we have a number of deliverables focused on health literacy, focused on engagement with external audience. But one of the key deliverables is these policy papers I've mentioned. We want to translate these into the policy area at the European level and at the country level. So while we have done the deliverable is a living deliverable in that we want to ensure the recommendations or the policy asks, whether on healthcare workforces or on the data needs or on the regulatory framework or the investments that's needed, are translated into the healthcare system. So this is a core focus in year 2, in year 3, and maybe year 10 if we go further.